Can you hear me now? Can you hear me now? Can you hear me now? Let me know if you can hear me. The messages just popped up. Is there still any no sound? I might have to start over. I might have to start over in Instagram, so give me a minute. I see them saying no sound. Can you hear me now? Let me know if you can hear me now. Can you hear me now? Anybody? The sound is back now? Alright, good. Apparently it reset to default. Alright, good. It's low. Is this better? Is it better now? Is the sound better? Alright, good. So you're hearing me loud and clear. Alright. So I wasn't aware that you weren't hearing me. Since you weren't hearing me, only can share it up now, please. Alright, let's get the show on the road again. So, as I said, basically, just to update you on the figures. Alright, so Anthony Ferron over by YouTube is saying he can hear me. That's good. Thank you, sir. Thanks for joining me. Alright, so as I was saying, the numbers, 318,000 cases, 379 cases confirmed worldwide, with 13,600 deaths so far. Now, Italy is a catastrophe. I'm just recapping. Italy is a catastrophe. The USA is, boy, the USA is catching up. All right? And Trinidad and Tobago, as we were saying, they had a cruise ship issue, and they had people who went off on a cruise ship against the advice of the officials, and 41 of them have come back testing positive, but they're all in one area. All right? So now I want to play a message from Dr. Tedros Tedros, let me just try and pronounce this man's name. It's always a tongue twister. Tedros Adhanom Ghebreyesus, who is the chief director of WHO. On Instagram, this video is already uploaded to my IG stories, so you can always go and watch it after. But this is just what he has to say about testing.
In the past week, we have seen a rapid escalation of cases of COVID-19. More cases and deaths have now been reported in the rest of the world than in China. We have also seen a rapid escalation in social distancing measures, like closing schools and cancelling sporting events and other gatherings. But we have not seen an urgent enough escalation in testing, isolation, and contact tracing, which is the backbone of the response. Social distancing measures can help to reduce transmission and enable health systems to cope. Hand washing and coughing into your elbow can reduce the risk for yourself and others. But on their own, they're not enough to extinguish this epidemic. It's the combination that makes the difference. As I keep saying, all countries must take a comprehensive approach. But the most effective way to prevent infections and save lives is breaking the chains of transmission. And to do that, you must test and isolate. You cannot fight a fire blindfolded, and we cannot stop this pandemic if we don't know who is infected.
As I said to you,
we have
Instagram,
a simple message for all countries.
Is available
test,
on my IG stories.
Test,
when you finish, you
test.
can go and watch it.
Test every suspected case. If they test positive, isolate them and find out who they have been in close contact with up to 2 days before they developed symptoms, and test those people too. Every day, more tests are being produced to meet the global demand. WHO has shipped almost 1.5 million tests to 120 countries. We're working with companies to increase the availability of tests for those most in need.
All right, so that was Dr. Tedros Ghebreyesus, the chief, the WHO Director General. That's his correct title. He's the Director General of the WHO. Now, he could not stress enough about the testing. And you know, we can look at what is happening around the world. We can look at what is happening around the world to see where there are failures and where they are good. If you examine the figures, we're going back to the figures again. And I want you to just look at the figures coming out of South Korea, who started out early, but they, remember yesterday we spoke about flattening the curve. South Korea came out early and they tested everybody. South Korea even had a drive-through testing capabilities. I've seen USA started doing that in some states like Florida and Texas now. But basically what they did, they came out and they started testing every single body, right? What Dr. Ghebreyesus is saying is that you are to test whether them have symptoms, whether they don't have symptoms. Once they come in contact, once you do your contact tracing and you can trace them back to a positive, somebody who is positive, you are to have them tested. Because at the end of the day, remember that this virus incubates for 14 days, up to 14 days, and the patients who are incubating are most of the times asymptomatic, meaning that they don't even know they are sick. Now, there's something of concern that popped up in the Gleaner this morning. And you know, as I said, we have to be careful. We have to be very careful how we deal with this thing. They're running out of tests. Tamora is saying they're running out of tests in the US. You know, but even if they're running out of tests, more tests are being produced. You have people who are making millions of tests daily. We need to just get the test, just do the test. Do the test. It's better you run out and don't have no test than you try and conserve and you miss cases. Because you cannot fight an enemy that you cannot see. Right? And how this disease is, a lot of people fighting enemies that a lot of administrations worldwide are fighting enemies that they just cannot see. Now, this is of great concern to me. Doctors, nurses test positive for COVID-19, not included in Jamaica's confirmed cases. I see Wayne Chen on social media saying that this is fake news. The Gleaner released 2 articles with this information, and I am waiting Gleaner. He says that it's fake news. According to Gleaner says that they are quoting the health minister word by word. There are a number of people who, having dealt with a patient, subsequently tested positive. Tufton told the Sunday Gleaner yesterday. This was quoted by the Gleaner. Additionally, he said a number of frontline people have been quarantined because they were exposed to the virus. There have been more nurses and doctors. We have had the doctor who initially looked at patient 1 and his assistant who had to be quarantined, and we have had 1 or 2 other cases he disclosed. So I don't understand why we are hearing people saying that this is fake news, because the minister quoted, right? The minister was quoted by the Gleaner. And you know, healthcare practitioners have been very, very concerned. They have been asking, according to another Gleaner article, we have been asking for weeks, months. When we heard about the coronavirus outbreak in China, we kept on asking, what are we going to do? Jamaica and China business is almost like US and us. So it was just a matter of time before it reached us. But everyone was just hoping it away. A senior medical professional with more than 30 years experience who asked not to be named. You see, and this is what we're seeing in a lot of cases. We're seeing where they are basically being, healthcare professionals are basically being bullied into silence in some cases. And I've spoken to a lot of them, so I know a lot of them come to me and give me information because they're basically afraid to talk on their own. Because them say them just afraid. You understand? The Observer has an article to say the Gleaner article is fake. That is, you see what I mean, Sashi Sweet? The Gleaner, to me, would have to come out and say that they would have to retract their article and say it is fake. Until they do that, if they can stand by their source, there is no reason. And they said that there is a recording. You know, we need to stop politicizing this thing. We need to understand. I wondered what of these healthcare practitioners who came in contact. We know that they don't have enough protective devices. So what of them? You know, I knew someone who came from New York on Saturday last and was not tested. He's at home in Mandeville, and I'm not sure if he's self-quarantining. You see, we just don't know. Anyway, the good thing is they have shut down the airspace to incoming flights, so that is that. What concerns me, another thing that concerns me is that the chief medical officer in Jamaica is saying that they can only test symptomatic cases. Now, this is of great concern to me, and you don't have to take my word for it. You can, I'm going to Google it and show it to you right now. Chief Medical Officer, Jamaica, testing COVID-19. I'm going to Google it and show you. All right? Five in isolation waiting for testing. But she did say that they cannot test everybody because they don't have the cases. If one person escapes untested, if one contact escapes untested, and let me tell you something, we have already established by the WHO protocols that testing is a must because of the fact that so many people are asymptomatic for the first couple days, right? So to only test people that are symptomatic is fighting the enemy blindfolded. As Tedros Ghebreyesus said, it is fighting the enemy blindfolded, and you cannot fight an enemy that you cannot see. So if we want to flatten, remember this diagram from yesterday that I've been drawing for, the curve? If we want to flatten this curve, change this to this, we have to start testing. If we want to change this, let me show you. We want to change this into this, we need to start testing this. Let me show you better. We want this. We don't want this. All right? If we want to get that curve flattened, we need to basically just test. The Prime Minister has a very interesting video on his Facebook page that I shared that explained exactly the need to do what we are doing. The need to self-quarantine, the need for social distancing, the need for all of these things. It was a brilliantly done video. It's an explainer video. You know, the animated explainer videos, and it basically shows why we need to do what we do in terms of social isolation and distancing, testing, everything. So I don't understand why Jamaican authorities are saying that, listen, we can only test people who are symptomatic. We also have to remember that remember dengue? Dengue was like one of those blind enemies where we were fighting in the dark, where people just turned up with different symptoms. Nobody had the same symptom for dengue. Some people have diarrhea, some people have throat symptoms, some people have headache, different symptoms. They are saying the same thing with COVID-19. Some people don't have any symptoms at all. Some people start with a dry cough. Some people start with the sore throat. Some people even have gastrointestinal discomfort. So basically, We don't know unless we test. Now, as I say, it's not just JA saying that, US is saying the same. This is why it's failing, and this is why we need to follow what WHO is saying. You understand what I'm saying, Sonette? We need to follow what WHO is saying. WHO is saying, listen, we will produce the test, just test. Even if you're out of test for a minute, we're going to get you more tests. Just test. Just use up your tests. So, okay, you got 2,500 tests. What are you conserving tests for? Use them and then request. When you get that 2,500, request 2,500 more and use up the tests that you have. Right? We need to get to the point where people can just go in and test themselves, whether they are symptomatic or not. Another thing we need to do is find out where private practitioners, because what made the dengue thing get under control so easily is when the private practitioners were able to test. Now I say Andrews Hospital put up a notification that, listen, if you a news release from Andrews Memorial Hospital from March 20, please be advised that with immediate effect, Andrews Memorial Hospital will no longer be seeing patients with signs and symptoms of COVID-19. Fever, coughing, running nose, cold, and shortness of breath. Remember now, these symptoms are also associated with the regular flu. Some of these symptoms are associated with dengue and other viruses and bacterial infections, not just COVID-19, all right? So this one is very sticky. Persons with recent travel history within the last 14 days, they've not seen you either. People who have been in contact with persons with recent travel history, they're not seeing you either. The restriction has become necessary due to the lack of appropriate facilities to adequately manage COVID-19. Persons in the above categories are being asked to call the following government-issued numbers to discuss the symptoms with the doctor online. You will be redirected to a government facility to receive care, and they list out everything. So they will be suspending the following services to the public with immediate effect: dental, cafeteria, US Medical. So this is Andrews Hospital. All right. So look like you can only go have Andrews go have baby now, because what they're saying is they ain't doing anything else. All right. So at the end of the day, if you become sick, now is not the time to become sick. Now is the time to try and stay as healthy as possible. I would have preferred if people had more access to personal protective equipment, number one, and people had access to testing. What controlled the dengue spread was the fact that people could get tested, right? Private healthcare practitioners basically started getting access to their own testing supplies. Funny how celebrities can get access to it fast. They are picking the ones who get it. The money put aside for coronavirus will not reach the people. Question is, what if a person got better from it? Can they still infect somebody? I heard no debate on that. That's a very good, Marie, that is very good. Listen to me. It's I need to show you another graph. I'm going to show you another graph. Give me a minute, I'm drawing, okay? All right. Incubation, sickness, and recovery. That's the three phases of basically every single infection. All right. So with COVID-19, they're saying that this is from 0 to 14 days. This one is about another 14 days. Because them say you can be sick with it for like a month after 20 plus days. Let me show you over here. All right. So incubation, you can spread it. When you're sick, you can spread it. When you're getting better, you can spread it. Incubation, you can spread it. That's the first up to the first 14 days. When you have the symptoms, when you're sick, it can spread. It can spread in recovery, which is after about 20 days. So it can spread right through. You spread it the most when you're at the peak of your sickness. That is when you shed the virus the most. But you can still be shedding virus in the incubation and in the recovery. This is why testing is so important. This is why testing is so important. And that is why you have to test right throughout. One person will require testing at several points. So you test here. You're going to test here. And you're going to test times 2 to determine if the person has recovered fully. So you test here to diagnose the illness. You test here to check the viral load to see how sick the person is. You test here again. Yes, sachet sweet, that's a very good question. The person can be asymptomatic right through. And that is what half of the problem is, because you have people who are so mildly ill, they don't get very sick at all. They probably have a little sniffle. They probably sore a little, but they are still shedding the virus. So over here now, they test at the beginning, they test during the sickness at the peak, and they test at least 2 times. To determine, the guidelines to determine full recovery is 2 negative tests within 48 hours, and they do that through nasal and throat swab. Because testing has become so non-complicated now, that's why I'm saying that we can find a way, and I'm going to do my research to see how accessible the test kits are to general practitioners. We understand? We must be able to arm our practitioners now, or people because the symptoms are so varied. Me can get sick now, me have a little sinus drip. I may decide to go to doctor for antihistamine, and I could very well have this disease and don't know, and I would infect the doctor and the people in there, and they get very sick with it, but I wasn't sick with it. You understand? This is why testing is so important, and we need to encourage testing. So maybe it is that we need to find a way to get access. Private doctors, private practitioners need to find a way to get access to testing as well. This is what actually helped to slow down the spread of dengue, because people were able to test positive when they go to them doctor. I know Dr. Petra Hines was at the forefront of that. She imported her own dengue testing kits, tested her patients for dengue. She actually sold dengue testing kits online to people who just wanted to order to test themselves. You understand? The more testing can be done, the better it is. Because, as I say, not everybody going to get sick with this thing. I'm trying to see what. Alright, no more comments over there on YouTube. Remember YouTube to like and share it for me, please, so that people have access to what we are saying. Alright. Yeah, so I think that's about it. We don't have much more to discuss. Where the testing is concerned, other than we need to get to the point where we can encourage people to the testing. Remember, tomorrow is Monday Morning Meds, and of course we'll be talking about this. We'll be talking about a few other things. Monday Morning Meds is not just about coronavirus. It's about many other things. Alright? I'm gonna try and get my IG audience on Monday Morning Meds too, because Monday Morning Meds is like the flagship program that I do, and now that I've figured out a way to get my IG audience on board, I'm definitely going to include you in Monday Morning Meds. Yes, Camille, yes. people have reported there is a 14%, and this is something we need to discuss, because according to the medical officials, the jury is still out on if you can be reinfected with coronavirus. But studies coming out of China are basically suggesting that there is a 14% reinfection rate right now. You understand? There is a 14% reinfection rate. So now that makes sense to me. Follow me now. You have two strains, right? So you have L and S. It started with S. Wait. We started with the S strain. And the S strain mutated to the L strain. Alright, we started with the L strain. And the S and the S mutated to the L. Alright, those are the two strains of COVID. Well, the bacteria, the virus is actually called SARS-CoV-2 virus. Alright? So the SARS-CoV-2 virus started out with the S strain, and the S strain mutated basically into the L strain. Now, if you think about dengue has mutated 4 times, right? So you have dengue 1, dengue 2, dengue 3, dengue 4, and you can catch dengue 4 times. You hear from the practitioners that dengue has mutated enough that you can catch it 4 times. So if we're following the same principle of mutation, it would basically suggest that you can catch the L strain of COVID-19 and you can catch the S strain of it as well. You can catch both strains. You understand? That if you follow the logic, you can catch them more than once. You understand? So this is why I don't understand why they're saying. What they're trying to suggest is that it doesn't mutate, it has not mutated enough for the body to not recognize it anymore. We don't know that yet. We don't know this yet. You understand? And we're learning so much about this thing. And as I said, Japan has reported cases of reinfection. China has reported cases of reinfection. What they're saying is that the mutated L strain is much more dangerous than the S strain. The S strain is kind of mild, but they're saying the pandemic has been caused by the S strain. You understand? So I don't know. All right, I see a very... My friend in NY has it. She says she feels like 1,000 pieces of broken glass splinters are in her lungs. Sean, this is what I've been hearing. I've also spoken to a Jamaican man in Italy. I've told you about Shane, who is in Italy, who has it as well. We keep hearing them describe what happens to the lungs, how the lungs feel. And I think this on Tuesday, because as you know, tomorrow we have Monday morning med, so Tuesday we'll have more COVID-19 talks daily. I think on Tuesday we are going to look at what COVID-19 does to the lungs. I think that's what we need to discuss. We need to look at what it does, the damage it is doing to the body and why it kills. I want you to understand. I'm not going to get into much detail, but I'm going to break down for you what COVID-19 actually does to your body and why so many people are dying from it. I think that's what we're going to talk about. And we also have to discuss the use of NSAIDs. That's another big topic that we need to discuss, because I see where the WHO first warned against the use of, and NSAIDs are non-steroidal anti-inflammatory drugs, and these are widely prescribed. Voltaren, Cataflam. And I remember my video, my famous do not take Cataflam video for dengue. Voltaren, Cataflam, ibuprofen like Advil and Motrin. All of them something there. With diclofenac. What else? Let me think about aspirin. These are all non-steroidal anti-inflammatory drugs, right? And these are generally contraindicated with many of these viruses, especially viruses that cause a reduction in platelet count called thrombocytopenia. That is the correct name for the drop in the platelet count. We saw a lot of this with the dengue cases. A lot. That is why the papaya leaf juice worked with dengue, because papaya leaf juice elevates the platelet counts. All right. So we're gonna discuss this as well, because there is suggestion that COVID-19 also reduces the blood platelet count. So they backtracked on it. They backtracked on their initial warning. I'm not sure why, but we are going to discuss that on another day too. So two things we're going to discuss: the NSAIDs, and we're going to discuss what COVID-19 does. So that's it for today. When I get brought up, when I get extra time. So see you tomorrow morning, 9 o'clock sharp for Monday morning meds. We're going from 9 to 10:30. Instagram, you won't be left out of this one. So join me tomorrow morning. We're going to discuss everything. Take care of yourself. Bye. All right. Let me end with you guys over here as well.